Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Muhamad Aly Rifai. He's an internal medicine physician and psychiatrist. Today's Kevin MD article is How Data Accuracy Failures Are Costing Lives and Money in Healthcare. Muhammad, welcome back to the show.
Thank you very much for having me to talk about this important and timely topic, especially in medicine.
All right. For those of you who get a chance to read it, what's this article about?
Sure. So in the article, I talk a little bit about the importance of data in healthcare. The field of medicine now has become data driven. We have a large amount of data that is available and that produces results for us in terms of our decisions with payments, our decisions with outcomes, our decisions with treatment modalities. And we have seen how significant amount of data can affect different decisions, as well as the fact that if we don't have data accuracy, that actually impacts our decisions. And we've seen recent events in government of how data accuracy have caused significant amount of ridicule in the media about some data accuracy issues with the Social Security Administration and Medicare.
All right. So you're in the world of psychiatry. I'm in the world of internal medicine and primary care, and absolutely, I'm seeing it on my end about how everything is data driven, how everything is metrics based, from how hospitals and physicians are reimbursed to patient care in terms of the metrics that a lot of doctors have to meet to ensure that patients are receiving the best care, and everything is becoming more database. So, how about in your world of psychiatry? How does that intersect with what you do in terms of data-driven medicine?
So it's very important in terms of data-driven practice of psychiatry is for us to be able to identify truly what's going on and whether the data that we have truly represents what's going on. So an example that I give is actually how treatment modalities sometimes produce results and that some of the results may not be very meaningful. Over the last few years, we've come to dispute some of the notions that we had in the field of psychiatry, such as the efficacy of antidepressant medications. We've seen that placebo effects in some of these studies actually has risen significantly. And we've seen that actually the efficacy of antidepressant medications may not be as we like it to be. And now there's a whole movement distrusting actually the efficacy of antidepressant medications based on reanalysis of some of this data. So having very accurate data would be very, very important. Also, we've seen that not having the correct data in terms of payment, in terms of assessment. I can tell you my personal experience with not having very accurate data in terms of kind of analyzing things have got me some in trouble. We've heard recently in the news Elon Musk and the president talking about their analysis of the master file of the Social Security Administration, where they discovered some individuals above the age of 100 years and above the age of 150 years, and even an individual who's 360 years on the rolls receiving Social Security benefits. Maybe those were anomalies, maybe those were errors in data entry, but having a just reliable data set is very, very important because it kind of gives legitimacy to the field of medicine, as well as people will feel confident that the data that they're receiving is reliable and meaningful.
So you're talking about what sounds like two different sources of potential confounders in data. The first regarding reassessment of previous clinical trials, right? That can change
Yes,
the data that we're using. And
yes.
the second, we're talking about just simply inaccurate data that we may be entering about patients in our electronic medical records that could lead to mistakes and potential fraudulent billing that may be going forward. So how common is that in medicine from what you see in terms of, let's say the second one, in terms of just simple mistakes in the patient record that can lead to problems with accuracy and errors in patient records and in billing?
Sure, sure. So the error rate in our data in healthcare records actually stems from the Institute of Medicine report in the early 2000s. They titled it, "To Err is Human." I mean, we're human. And so data entry errors are pretty rampant in healthcare. I mean, as some of the estimates are around 40 to 60%, there's some data entry errors somewhere in the in the healthcare system. And sometimes that can have significant impact in healthcare, medication errors, billing. So it is significant. In my case, I had some staff who did some data entry errors and resulting in actually submitting bills on patients who are deceased. And we've corrected that, but that got me into significant trouble with the government with a prosecution. But when that was revealed that these were data entry errors of entering data on one patient versus another with the same first and last name but different date of birth, one was deceased and one was alive, that was corrected. But sometimes really that can lead to significant bad outcomes, as well as, for example, entering orders on patients with a different date of birth, giving medications that are not needed to another patient that could be significantly detrimental. So errors are out there, but being able to identify that errors happen and being able to identify that they need to be corrected, I think is very significant.
And I think you've told your story, of course, on prior episodes, but just to reiterate, you had staff members enter the wrong data, and that led you into an experience with federal prosecution. How long did that experience last? You don't have to rehash your whole story, but how long
It,
was this ordeal for you?
it lasted for a few years, and that was one of the catalysts for that is billing on deceased patients. And when the data was unhashed and we reviewed the data with the government, with the jury, we found out that they claimed that I billed on deceased patients who died before I was born. So so even the government, when they presented these allegations, most of their data was inaccurate because the artificial intelligence collected made up data on deceased patients that died before I was born. So um, the errors go both ways, but being able to acknowledge that this was an error and was being corrected was very important in convincing the jury that this wasn't any fraudulent intent, but it was just a simple data entry error. But sometimes that is not just a fraud prosecution. Sometimes errors in data entry on different patients can lead to giving the wrong medication to a patient that could be fatal. So we could have bad outcomes with that too.
In your article, you also talk about the case of Dr. Richard Paulus and how flawed data contributed to his prosecution. For those who aren't familiar with that case, just tell us about that connection between his prosecution and flawed data.
Sure, sure. So Dr. Paulus was an interventional cardiologist in Kentucky who came under the attention of the federal government because he had a large interventional medicine practice, which actually caused the government to focus specifically on the rates of him inserting stents into occluded or narrowed coronary arteries. And they found that what they thought was a significant anomaly in his billing. And he went to trial twice. And he actually was incarcerated for almost 1 year and endured a prosecution of about 12 years, while ultimately the federal government dropped all the entire charges against him. But his prosecution stemmed from the fact that the government identified a large universe of cases where they thought that he did something wrong, but only presented to the jury a small number of cases and presented those small number of cases, around 70 cases, as the universe of what he has done. So out of 70 cases, they said, well, he inserted stents in all of these 70 cases, and 100% of what he decided to insert stents on was not valid. And other cardiologists thought that stents should not be inserted in those patients. While in reality, the federal government looked at 1,000 or 1,100 cases and only found that 70 cases were disputed. So that's a big difference. difference from 100% to going down to 5 or 6%, which is an acceptable differences in rates of whether one cardiologist thinks that the narrowing is 50% versus 70%. And that was a much more acceptable. And when those facts were shown to the jury, that led to a significant direction in his case. But that wasn't until after 12 years of prosecution, 2 trials, and 1 year in jail, where actually the appeals court reversed his conviction and set him free. And finally, the government decided to drop all charges against him.
So tell us about the path forward. What are some ways that physicians and hospitals and medical institutions can prevent these data errors and reduce these fraudulent billing and just data inaccuracies as a whole going forward? What are some potential solutions?
I think there's just human working on human training, working on trying to add additional layers of review, trying to admit that errors happen, and trying to have multiple layers of review, multiple layers of trying to catch these errors and correcting them before they have a meaningful impact on things, and identifying and admitting that errors can happen, and that most of the time these things are not fraudulent. So in the case of a person who's 360 years old who's receiving Social Security benefits, whether that's a data entry error, that could be easily investigated and corrected. The fact that these errors get publicized really will make people, the citizenry, lose confidence in some of these data sets, and that a lot needs to be done. So, for example, in the case of the Social Security Administration, they've decided that actually putting time and money into a group of staff that will go and comb through this master file of the Social Security Administration to clean up those inaccuracies is worthwhile. Same thing with hospitals, is having teams that go around and review things, correct things, as well as the government admitting that errors can happen and they're not always fraudulent or criminal.
We're talking to Muhamad Aly Rifai. His Kevin MD article today is How Data Accuracy Failures Are Costing Lives and Money in Healthcare. Muhammad, let's end with some take-home messages that you want to leave with the Kevin MD audience.
To err is human. We have to admit into our limitations, but we have also to redouble our effort to provide our patients with accurate, appropriate, and safe care.
Muhammad, thank you again for sharing your perspective and insight. Thanks again for coming back on the show.